That brings us to your weekly capsule of health information. We call it Your Healthy Dose. We're going to talk about breastfeeding today. And here in our studio is the director of the Women's Care Unit at Hannibal Regional Hospital, Linda Dingus. It's Dingus?
Yes.
Okay. And Sean Nayans?
Nayans.
Thank you. Joins us as well. And thank you, ladies, very much for coming by. And I know this is a topic that used to be taboo on broadcast airwaves, but really it needs to be dealt with.
It's an exciting time, I think, for mothers that are breastfeeding because of the media and how we're watching women breastfeeding in public. We're also recognizing in the state of Missouri in the month of August that this is a month to look at breastfeeding and support breastfeeding. Mm-hmm. It's really exciting to recognize that what we can do for mothers, because breastfeeding is it's a challenge, because every time you breastfeed a baby, you get a little bit better at it. And at Hannibal Regional Hospital, we're a baby-friendly designated hospital, so we also celebrate what we can do to help mothers the duration of their breastfeeding. So we're there to support them.
I know there was a little anxiety with my my young one when she was born. She didn't take to it right away, but eventually the instinct kicked in, and that's the rest of the story.
Well, and the one thing that we do as a baby-friendly hospital, we introduce skin to skin immediately after birth, and that's where the baby is placed without any clothes on, right next to mother's chest, and that bare chest brings the smell into the baby's environment and recognize that the baby really has an instinctive reaction then, just like a baby kitten or a puppy to go at mother, and we watch that baby even just crawl up to mother's breast, and it's exciting.
And in some cases it just happens. Other cases you just kind of have to nudge them along a little bit.
Well, it actually is associated with mother's medication during that labor process. If she's had a lot of medication, sometimes those babies are a little bit sleepier. If a mother hasn't had any medication, or at a time when the medication will be moving through the baby system, the baby is more alert. So we see babies that really do go after it if they've not been introduced to any medication during that labor.
Now, I know that some people say, hey, there's formula, that's what that's for, but really, what's the benefit of breast milk for the baby?
Well, personally, as a breastfeeding mom, I really think that the attachment is really strengthened between the mom and the baby when you breastfeed. I can see instantly as soon as my baby is crying, when she gets into my arms, she starts to calm down immediately, because I think she notices my smell, but also knows that I'm able to provide her the nourishment that she needs to no longer be hungry, but also it's very comforting for her. I think that skin-to-skin contact, like Linda was talking about, is very, very soothing to the baby. They know instantly that that's their mother and that they can get what they need from that mom. And I just think that it really, really is a wonderfully natural calming effect for the baby and for the mom, too. The mom, I can't tell you, I breastfed my first for over 14 and a half months and never thought I would want to do that. But I will tell you, when you have to stop, it really is a hard challenge, because you just, it's a very intimate time. You are forced to sit down in our busy schedules and look at your baby and talk to your baby and just appreciate them when they're just that little infant, because they don't stay that little for very long.
But they're also getting, unbelievable nourishment in just even a small amount of breast milk, which they don't really get fully from formula.
Yes, absolutely. The breast milk is perfectly formulated for that baby's needs. No matter what they're going through, if they're getting sick or anything like that, the mom's body responds to their needs. They make the proper nourishment, they make the proper antibodies that baby needs to be healthy. And most babies that are breastfed, they don't get sick, they don't get the common cold as often, they don't get RSV as frequently and stuff, because that mom is able to provide the exact nourishment they need at the exact time.
So that adds a lot of pluses in the long range aspect, because of that immune system that's been built up because of this natural process.
Yep.
The ultimate question is, all right, how long do I breastfeed the baby? Because there was a story that came out of Champaign-Urbana a while back. This woman was still breastfeeding her 5-year-old.
Yeah. Yes, we hear stories about that throughout the years. But a woman can and her baby actually together decide how long they're going to breastfeed.
Really?
The American Academy of Pediatrics recommends 6 months, but they're also saying after you introduce solid foods that to continue with breast milk as long as you feel fit. There's many children that can drink breast milk out of a sippy cup and out of a regular cup. So it's women also can breastfeed while they're pregnant with another child, and that's years ago they felt that that wouldn't be possible. But we see a lot of different things. Women that have children with disabilities, that may be more susceptible. A Down syndrome child is more susceptible to infection. So many times you see a mother with a Down syndrome child who may breastfeed if she's able to lactate and give her child will continue till the child is 5 or 6 years old because of that strong immunity and to save her baby's life.
So if we are going to breastfeed for 6 months, okay, maybe mom wants daddy to kind of get involved, all right? So formula aside, there's the pumping that can go along with that and supplement that as well. There's different ways to pump.
Absolutely. There's great technology now. Pumping is not what it was 20 years ago. It's much easier. There's all kinds of tools that you can use that make it very convenient for working moms, especially. And it also gives that dad the opportunity to have that one-on-one bonding experience. I know that's something that my husband really enjoys to get to do once in a while. And sometimes even when I'm around, I'll just pump so that he can feed her once in a while if I'm home more often. And it's just kind of a nice thing because it's something that he can do with her. But he fully supports the breastfeeding because he knows that's exactly what's best for the baby. And it's no different feeding them a bottle of breast milk. It's much easier than it would be formula because, that's constantly with you and everything. So it's a very easy thing to do if you want dad to help along too. Well, it's not something that has to be a burden, quote unquote, that's just for the mom. It's a joy for both mom and dad.
You just have to take a little time doing it. And make sure the containers are properly cleaned and stored. But it also allows dad to have a special bond, just like mommy does. It may not be the same, but wow, it comes close. I will never forget the look of my daughter when she got her tummy full and then I'd have to burp her. Seems like yesterday. So what special programs does Hannibal Regional offer? Is it pre-birth classes, post-birth support?
We begin with a breastfeeding class right before mom would have her baby, that she can come. We also have support groups every Friday night at 5 p.m., and all mothers are invited, and if they're pregnant before they have their baby, and then afterwards they can bring their babies with them. So it's a support group where we talk about anything that pertains to breastfeeding. Sometimes it's to going back to work. Many times it's a mother who wants to increase her breast milk supply if she has a child that's struggling, and we also weigh the baby. And then we meet again on Wednesdays, every Wednesday at 10 a.m. So we have an evening and a morning one. We also do, we have a 24-hour warm line at Hannibal Regional Hospital where you can call and talk to a lactation consultant within a few hours. It may not be immediate, but even in the middle of the night. So we have it available to mothers that are having any problems. And then all the nurses at Hannibal Regional Hospital have had 20 hours of education during this baby-friendly designation and continuum. So all of them are experts and to help mom breastfeed.
Good to know. I was the one that always had to feed at night. I know she's listening, most of the time, because I worked late. And so if they went to bed early, then it's like I'd get home, go upstairs to the bedroom. Can you feed Audra? I was like, sure.
One of the tricks, I think, especially mothers that have cesarean birth, and I experienced 3 of those in my childbearing time. My husband used to get the baby up, change the diaper, and then I would feed the baby, and he'd put the baby back down. The one thing that with breastfeeding babies that they actually have softer stools and may go a little more frequent, but you don't want to use so many diapers, so you try to change them maybe beforehand or in between breasts, and it really makes a difference. But what breastfeeding does for a baby's GI system is amazing. And we have less problems. They look at diabetes. The rate of an adult having diabetes because they're breastfed goes way down. Cancer, asthma, ear problems, all of the things that help the body build strong systems right from the start. So breastfeeding actually brings healthier adults.
Linda, are you seeing more women breastfeeding now than, say, 20, 25, 30 years ago?
Yes, we're about 85% right now.
Are we really?
When before Baby Friendly in 2009 is when we became Baby Friendly. We were in the 50%. So now we're looking at the duration on what we can do. We're about probably anywhere from like 55 to 60% with women that breastfeed for 6 months. Now we're trying to help them so that they can breastfeed maybe a little longer.
Okay.
You know, so we in years when we first started this, it was about at 30%. So.
Interesting.
We're following it all around the state now.
So again, basically, the 6 months, that's the average. But again, like you said, Linda, it depends if baby wants. You know, supplement the fingers, solid foods with breast milk, and then the baby will decide.
Yep. The American Academy of Pediatrics recommends for the first 6 months to exclusively breastfeed. I know some people introduce other foods at 4 months, and that's kind of up to you. But as far as the Academy of Pediatrics, they recommend 6 months exclusive breastfeeding, and then continue to breastfeed for the first year until they are introduced to, if they want to, cow's milk and everything. Because no matter what, a baby has to either have breast milk or formula for the first year. So it's really good to just let the baby kind of lead it. You know, they say that the baby weans themselves, and typically they do start to think about that around 11 months. They have that instinct in them. They know about that time. But then there's some babies, and mine was one of them, that didn't want to quite then, and so I just continued until she was ready. And it's just amazing. They kind of wean themselves off, and you know, she took it from a bottle and whatever, you know, afterwards, sippy cup and stuff too. So it's just kind of, you got to let the baby lead the weaning process.
If mom does not start the breastfeeding process right away, there is a timeline before she can't breastfeed anymore. Is that what is that? Is it about several weeks? Is it a month?
There's actually some studies that say that anytime, even if the mom wants to, they can try to, and it somehow your body responds and it can kick in.
Okay.
It's much more difficult to get your breast milk to come in if it's not initiated earlier on, but it can happen. You know, if a mom decides a month after she's had him that the baby seems to really like that skin contact and likes to nuzzle in, and she might want to try to nurse. It's amazing how your body can respond and start to produce breast milk and stuff.
It's amazing. Amazing, the human body.
The one thing that I've been an OB nurse for about 30 years, and we've helped women that are adopting babies begin the lactation process. They sometimes will take hormone supplements, and then they will begin to pump before the baby is born. Many times there may not be a supply that's enough for the whole time, but the mother is able to have that attachment, and the baby is able to get some of the nutrients from her. So I've done it about 4 or 5 times with women that we're adopting.
Interesting. All right. Lots of great information. The clock says we're running out of time. How do we get more information, Linda?
Well, you can get on the website with hrh.org. We have a breastfeeding web page. We also have a Facebook page. And we actually, if you call the unit, 573-248-5161, you can talk to any of the nurses. And then the warm line that we have is 573-406-2122. So we have information all over. As soon as you go to the web page at the hospital, you can find us.
Okay, good to know. Great information. Unfortunately, we're out of time, but thank you very much for coming by and giving us some of your time.
Thank you.
Appreciate
Appreciate being here.
Linda Dingus, the director of the Women's Care Unit, as well as Sean Nyans, joining us from Hannibal Regional Hospital, who, along with Hannibal Regional Medical Group, bring you this edition of Healthy Dose. And again, more information online, hrhonline.org.